So back in 2016, the US government launched this massive, multi-million-dollar effort to finally get a handle on the opioid crisis. But years later, there's this huge hanging question. Is any of it actually working? Well, a team of top scientists was brought in to find the answer. Let's dig into what they discovered. First, let's just be crystal clear about the stakes here. This number, over 81,000, it isn't just a statistic. That's 81,000 lives lost to drug overdoses in the US in just a single year. This is the devastating, urgent reality that these government programs were created to fight. So, to figure out if this big government response was making a real difference, the National Academies brought together a committee of experts. You can basically think of them as a team of investigators. Their mission? Follow the money, follow the data, and report back on whether these key government programs were actually doing what they were supposed to. And this explainer is going to walk you through what they found. All right, so what exactly was this massive government plan? Well, it all really boils down to one single, sweeping piece of legislation. It's called the Comprehensive Addiction and Recovery Act, or CARA for short. It was passed back in 2016, and it authorized over $181 million every single year to fund the whole spectrum of programs. We're talking prevention, treatment, recovery support, and life-saving overdose reversal. It was really designed to be an all-out assault on the opioid epidemic. Now, the committee's investigation wasn't looking at the entire law. That would be gigantic. Instead, they focused their magnifying glass on 4 specific programs that were getting federal money under CARA. Their job was to cut through all the noise and figure out, point blank, were these programs making any real, tangible progress? And at first, when the investigators started following the trail of all this federal money, they found a lot of activity. It seemed like things were happening. The programs were definitely up and running. So here are the 4 programs they looked at. You can basically group them into 2 main buckets, which makes it a lot easier to understand. The first bucket is all about direct support for people. One program for pregnant and postpartum women, and another focused on building up entire communities of recovery. The second bucket, that's all about overdose prevention, training first responders, and making sure overdose reversal drugs are easy to get. And the numbers they started seeing showed a flurry of activity. Take the building communities of recovery programs. They got more than 2,000 people in the door for intake interviews, connecting them directly with vital support services. Then you look at the overdose prevention side. Wow. The first responder programs managed to distribute over 14,500 kits of nasal spray naloxone. That's the drug that can literally reverse an opioid overdose in minutes. And get this. Those kits weren't just sitting on a shelf somewhere. The data shows that first responders used them to reverse over 1,800 overdoses. Just think about that. That is more than 1,800 people who were given a second chance at life. So, on the surface, everything looks pretty good, right? People are being served, life-saving medicine is getting out there, lots of activity. But, and this is a really big but, the investigators had to ask a much tougher question. Does all this activity actually add up to real, measurable impact? And that is when their investigation slammed right into a brick wall. A wall of missing data, incomplete data, and just plain flawed data. The investigative trail just went completely cold. So what was this wall made of? Well, it was a bunch of things. First, the progress reports they got were heavily redacted. Big black lines covering up key information. So they couldn't compare programs or understand what was happening locally. Second, the main data tool they used was only designed to track individuals, not the huge system-wide changes these programs were supposed to create. On top of that, they only got data from about 2/3 of the programs. And maybe the biggest issue of all, no comparison groups. Without a baseline, you have no way of knowing if the programs caused the changes or if they would have happened anyway. They also ran into this classic data problem called retention bias. Here's how it works, because it's super important. The people who are doing really well in a program, they tend to stick around for the follow-up interviews. But the people who are struggling the most, they're way more likely to drop out and their data disappears. So the result? The final numbers are skewed to only show the success stories, making the program look a whole lot more effective than it might actually be for everyone. So with redacted reports, the wrong tools for the job, and biased data, the investigators were pretty much forced to come to a really tough, sobering conclusion. This is the key takeaway, and it's a direct quote from their report. After all of their work, they concluded that they, quote, cannot determine whether these programs have had specific identifiable impacts. Now, let's be really clear. They're not saying the programs failed. They're saying the data was so bad, it was impossible to prove they succeeded. So why does a nerdy data problem like this matter so much? Because without good data, we're basically flying blind in a public health emergency. We can't learn, we can't tell which of these multi-million-dollar programs are working and which ones aren't. We have no idea how to direct our precious resources to the strategies that will save the most lives. We're just guessing. But the investigators didn't just point out the problem. They also laid out a really clear path to actually getting an answer. They laid out a simple roadmap. First, they need access to the full, unredacted data. No more black boxes. Second, they have to collect data that actually measures community-level change, not just individual outcomes. Third, data collection needs to be consistent across the board. And finally, they need to use proper evaluation designs, like with comparison groups, so they can prove that these programs are the specific reason for any success. And this leaves us all with a final, critical question. This report shows there's a lot of action, a lot of good intentions out there in the fight against the opioid crisis. But if we don't have the tools and the commitment to actually measure success, how can we ever really know if we're winning?